Welcome to The Explainer. Today, we're diving into a really fascinating treatment for that stubborn joint pain. It's called platelet-rich plasma therapy, or PRP for short. We're going to break it all down, using some great insights from the Westminster Orthopedic Clinic to see how it works.
So, let's just start with a question that I bet hits home for a lot of people. Are you dealing with that chronic, nagging joint pain? The kind that just sticks around no matter what and gets in the way of everything from a simple walk to the things you actually love to do?
It's such a frustrating cycle, isn't it? You've tried resting, you've gone to physical therapy, maybe you've tried different medications, but that pain, that swelling, and that stiffness, they just don't quit. And that's usually the point where people start thinking, okay, there has to be another way.
Well, let's talk about one of those alternatives, PRP therapy. And this is where things get really interesting. It's an advanced, non-surgical option that kind of flips the script because it's all about using your body's own amazing resources to heal itself.
So what is this stuff exactly? Put simply, PRP is a super concentrated dose of your own platelets. Now, platelets are these tiny little powerhouses in your blood, just jam-packed with growth factors that are crucial for healing. The whole idea is to harness that natural power and focus it right on the injury.
Yeah, you can think of it like this. It's your body's own personal repair crew. But with PRP, we're giving that crew a serious upgrade and an express ride directly to the site of the problem, right where you need that healing to happen most.
And once it's injected, that PRP gets straight to work. It helps calm down the inflammation, which, is a huge source of pain. At the same time, it's actively promoting the repair of damaged tissues. All of this helps improve your mobility and basically just kickstarts your body's natural healing process into a higher gear.
Okay, that all sounds really promising. But the big question is, could this actually be for you? Let's dig into the signs that might make someone a really good candidate for this kind of therapy.
So take a look at this list. Does any of this sound familiar? That persistent pain that just won't quit, even after rest and physio? Or maybe it's the swelling and stiffness that are really limiting what you can do. Or one of those nagging tendon injuries that just won't heal. If you're nodding along, especially if you're looking for an alternative to surgery, then this is definitely something to look into.
And to get even more specific, PRP is being used for a whole range of conditions, things like osteoarthritis in the knee, hip, or shoulder, common sports injuries, and those chronic tendon issues like tennis elbow or rotator cuff injuries. It's even used for early cartilage degeneration.
All right, so let's say you're thinking, hey, this might actually be for me. The next logical question is, what's the procedure actually like? Let's break it down step by step and take away some of the mystery.
First things first, and this is a big one for a lot of people, this is a safe, outpatient procedure. That means it's all done right in the clinic. No hospital stay, you're pretty much in and out with very little interruption to your life.
The process itself is really straightforward. It all starts with a thorough evaluation, where a specialist reviews your history and any scans you've had. Then comes a simple blood draw, just a small sample, no different than a regular blood test. That blood then goes into a special machine called a centrifuge, which spins it down to separate and concentrate all those powerful platelets. Then comes the critical step, the injection. They use an ultrasound to guide the needle, making sure that liquid gold gets delivered with pinpoint accuracy. And finally, you get a personalized recovery plan to take home.
Okay, procedure's done. So, what happens now? What's recovery like, and when do you actually feel a difference? This part is super important because it's all about setting realistic expectations. Now, it's important to know this is not an instant fix. Remember, we're stimulating your body's natural healing process, and that just takes time. So you'll need a little patience. Most patients start to feel a real, noticeable improvement in about 4 to 6 weeks. And you should also know that it's not always a one-and-done kind of thing. It really depends on your specific condition and how your body responds. But a full course of treatment might involve anywhere from 1 to 3 sessions. But one of the biggest upsides here is safety. Because the treatment is made from your own blood, the risk of an allergic reaction or your body rejecting it is extremely low. It's about as natural as a medical procedure can possibly get.
Let's talk specifically about arthritis for a second, because it's such a common reason people seek out PRP. We have to be really clear here. PRP is not a cure for arthritis. It can't reverse the condition, but what it can do, especially in the early stages, is pretty significant. It can help reduce pain, improve your mobility, and may even slow down the progression of the disease.
And what about getting back on your feet? Well, the recovery is remarkably quick. Most people are back to light, everyday activities within just a day or two. Now, you'll be advised to hold off on any really strenuous exercise for a bit longer, but you're not laid up for weeks on end.
So, let's just boil it all down. What are the big things to remember? 1. PRP harnesses your body's own healing power. 2. It's a solid, non-surgical option for chronic joint and tendon pain. 3. The procedure itself is a simple, 4-step process. And 4. Patience is key. Results typically start showing up in that 4 to 6 week window. And that leaves us with a pretty cool thought to end on. Is it possible that the future of healing is already inside of us? Therapies like PRP really suggest that for a lot of conditions, the most powerful tool for recovery might not be in a pharmacy, but already flowing through our own veins. Something to think about. Thanks for joining us on The Explainer.